All right. Well, good morning, folks. As you guys are starting to hop on here and tuning into the broadcast, please do us the huge favor of giving me a thumbs up, letting us know that you can see and hear us just fine. Also, dropping in a comment if you can, so I can know who you are that's on here, that's taking a second to be part of our updates and hear what's going on. I'll just go ahead and get us kicked off and started. It is Monday and a chilly morning at that. I'm Juliette Abdel, President and CEO of the Westminster Chamber of Commerce. Pleased to continue to bring you these live broadcasts on a daily basis. You can find our live broadcasts in the video section of this Facebook page. And as many of you are now aware, we are streaming this on our YouTube channel, Westminster Chamber of Commerce. You can find them dating back into March, whenever we've actually held them when COVID first unfolded, to today, when now we have a variety of experts that come with us. Of course, our mayor that kicks off the week and sets the tone for what's to come. Now, if you are new on our page, please make sure that you hit that like button and hit the notification wheel so that you can get alerted when we do go live. And if you are coming back to us, welcome back. Thank you for engaging and letting us know your thoughts, comments, questions, and all those concerns. So I already see several of you guys on here with us. I just wanted to quickly pull some of these comments up. We have Parker Brown with us. Good morning to you, Parker. Thank you for tuning in. I also see Wayne Anderson, who's using our YouTube platform to stream this. For those of you that have friends that may not be Facebook savvy or friendly, you can always point them to that channel. And of course, always engage with us on other social media platforms at Westy Chamber on both Twitter and Instagram. Good morning to you, Dave Carpenter, who's sharing a quick morning message to both you, Mayor, and myself. Of course, we have our board chairman, Brian Dice, hopping on as well. And I, of course, see our Councilor DeMont, who's tuned in. Brad, thank you for also hopping on and engaging with our broadcast this morning. The comment section is available to you during this entire broadcast time to ask us any questions, comments, or thoughts that you might have. Make sure that you type them in, and we will post them as soon as the mayor is done sharing updates our way. So with that, I want to turn this over to Mayor Atchison to share with us some updates around COVID, things that we should be aware of that are going on here in the city, county, and of course the state.
Well, good morning, Juliette, and the rest of you. And Juliette, you have got to quit blaming me for setting the tone for the whole week, because mine's all over the counter. You got to find a new intro to this. A lot of things are going on. I'm going to call up a sheet I have here for some notes. Many of our neighbors outside of Colorado are starting to see major impacts to the COVID, just as others. Last night, the Utah's governor announced a new statewide mask mandate, which is uncommon for most states to go to a full mandate. His comment is that the mandate will be in effect indefinitely, and a household only limit on social gatherings for the next 2 weeks. They have an average for 7 days of more than 2,000 cases daily. I want to talk a little bit about some of the things we're seeing here in the Colorado area. Sorry, I lost you for a second. As of this morning, we have approximately 40 counties out of the 64 that are above the 350 threshold. Adams County, as of about 20 minutes ago, our 2-week cumulative rate is 899.6, with a positivity rate of 13.7. Jefferson County is at 571.4 with a positivity rate of 9.4. The fact that we have so many counties that are in the red zone. Adams County right now has the second highest number in the state. Logan County is the one county ahead of us, and their numbers are skewed because of one location, and that's the prison that has a large outbreak. So if you take the prison numbers out, that makes Adams County #1 in the state for the infection rate. We are not seeing a leveling off. We're not seeing a decline. We are seeing a continued growth in our numbers on a daily basis, if not multiple times a day, we get updates. For those of you who have not heard, we have 2 counties that have gone on curfews over the weekend. Last night, on Sunday night, the city and county of Denver went to a curfew that starts at 10 p.m. and goes through 5 a.m. in the morning. On Saturday, Adams County went under a curfew as well. Now, on the Adams County order, this is what the order basically summarized for us. Spectators are prohibited at all sporting events, including Colorado High School Activity Association sanctioned sporting events. A nighttime curfew is imposed in all public places within Adams County, including streets and public rights-of-way, from 10 p.m. until 5 a.m. the following day. During the hours of curfew, any business that is not a critical business, as defined in Public Health Order 20-36, must be closed to public. Employees and individuals providing goods and services to the business are not considered members of the public for purposes of this order. Restaurants must be closed to in-person dining, but may offer curbside and delivery services. During the hours of the curfew, all persons are prohibited from using, standing, sitting, traveling, or being present on any public street or in any public place, with the following exceptions: providing or accessing necessary activities as defined in Public Health Order 2036, except that this does not include engaging in outdoor activity. Providing or accessing a critical government function as defined in Public Health Order 2036. Providing or accessing a critical business as defined by the same public health, and engaging in necessary travel as defined in the same public health order. Restaurants must limit party size to 6 people or less. For no more than 2 households, restaurants are encouraged to place a time limit on diners in order to maximize table turnover during hours of operation. All alcohol beverage sales, service, and consumption must cease at 10 p.m. Let me explain a little bit about that one. The purpose of the revision to that, previously it said you had to stop sales at 10 p.m. What they found was that people were buying large quantities just before 10 p.m. and staying in the restaurants or the bars and consuming them after 10. So this clarification is they cannot be there consuming them after 10. As required by Public Health Order 2036, all critical businesses, non-critical businesses, and critical government functions must adopt work from home or telework policies for any operations that can be done remotely. Remember, this went into effect Saturday night. Jefferson County has not said anything as of the close of business on Friday that they are about to issue the same health order, but with their numbers increasing, I will not say that that could not happen. If it does, I would anticipate it could happen, since the state directed them to go to level 3 last week, and their numbers have continued to climb. The mitigation plan that Jefferson County submitted was to try to keep them at level 2, which eventually was rejected by the state when the state ordered them to go to level 3. To the best of my knowledge, they have not started their preparation of a second mitigation plan since they got moved to level 3. And with the increases of these, we started to talk about this late Thursday and into Friday with the state on where our hospitalization numbers are. The projection that Casey Wolf, who is with the state CDPHE, made last Thursday was that the state would reach its limits of ICU beds, which is again is a limit of 1,800, that we would reach those within the next 4 weeks. So it'll be before Christmas. By the end of that period, probably closer to Christmas itself, their projection is that with the current rate of infection that we're seeing throughout the state, we could exceed our available hospital beds for ICUs by almost double. The other question was surge centers. As many of you are aware, we have a surge center that's predicated to be open at the old St. Anthony Hospital campus on 84th and Federal. The issue with that is the state believes that they could open that up, have it ready for service within 2 to 4 weeks for equipment and facilities. The issue the state has indicated is they would not be able to staff it. Where they would typically get surge capacity is from nurses and medical professionals from other states or other contractors. The contractors that they use have indicated they would not be able to support a surge capacity in Colorado because they're doing that in the states where they're already at. So the likelihood of us having sufficient medical personnel to open up any of the 3 surge centers in the metro or state area is very questionable. Hospitals are already seeing a shortage of staff because of previously layoffs, reductions in staff because of their budgetary issues, and people just getting burned out. So those things are still facing us as we see the coming months. There's not a lot of information this morning as to what the current hospitalization rate is, but with the projection they're making of us hitting our ICUs. And I do know that I talked to a couple of hospital CEOs late last week, and they were getting close to filling up their ICUs. They're seeing the surges already. Now, keep in mind that every bed in the ICU is not necessarily COVID. There are a lot of other health issues that put people into ICU. It could be from surgeries, it could be from heart, strokes, a multitude of different items that could put people in ICU. But the fact that the bed space is getting chewed up is what's, I think, important for us to continue to watch. The available beds is very concerning that we could be out within 4 to 5 weeks. And then, God forbid, somebody's going to have to make decisions if they fill up on who gets what level of treatment. And that will be up to the medical professionals. And I am very glad that I'm not somebody that's going to be in that position to have to make that decision for the hospital or for any family member. So as we go through this, please keep in mind all of the medical professionals who are in on a daily basis, working extended hours. Please keep them in your hearts and your mind as we go through this, because I cannot imagine the amount of stress that they are under on a daily basis coming into work, not knowing if their patients are going to make it through the day or not. So please keep them around. Juliet, that's probably as bad a news as I want to give you on COVID, because it just doesn't get any better every week. I wanted to, yeah, go ahead.
Yeah, no, thank you for that, Mayor, and thank you for allowing me to interject. I know you have a few more things that you wanted to transition to. We have a lot of people that have popped on and some questions that came through. So if you're okay with us answering some of those and then transitioning to the next part, that would be great. And I know, Mayor, that I say set the tone. I should have started by saying I do love having you on these broadcasts, and we work to make sure that the rest of the week provides the energy and some positivity that we can. Sometimes facts are just facts, and it's harder to make those into positive when they're not so Yes. So I do see Mario on here with us. I see Brian Head, Jason Gink, and Counselor Smith. I also see Lori. Thank you guys for tuning into our broadcast. Jeff Chapa as well. Jeff is just quickly sharing a quick thank you message our way for keeping us informed. Appreciate that, Jeff. This question does come to us from Lori. We were sharing about some of the updates for both Adams County and Jeffco, the new orders that potentially have come out and how that is reflected on our Adams County side. Most of what the mayor has commented is available into the comment section of this broadcast and is available to you at any point in time to rewatch. So please, if you are just now hopping on, make sure that you do a quick recap of that. Lori's question is related to playgrounds in Adams County and if they are still open.
Lori, I think it's going to be depending on what city you're in, what their varying rules are. There's still the issue of trying not to gather in groups of outdoors of more than 10, I believe, is still the rule, and not to mix families. Beyond that, I don't want to try to give you a specifics for a particular playground, especially since every city is going to be a little bit different on how they're interpreting that.
Thank you for that, Mayor. This question comes to us from Brian Dice. There are actually two questions that he has. I'm going to read the first one and then I'll pull the second one because it's kind of in tandem with this, if that's okay. This first one, well, actually, I'll wait and ask the second one after you answer this. The first one is about curfew and enforcement. How is the curfew enforced since we just had one of those orders go into effect on Saturday? And what would be required for people to prove that they're out for that critical activity, whether it's to pick up food that they've ordered, if they had needed to go to the hospital, whatever that situation may have been?
Brian, this is going to be my best guess. In Denver, they are actually doing enforcement through citations, and they will stop people to figure out where they're going. And they have been issuing citations for violations as they have under their particular order. The public health order that is issued by Adams County does not specifically define how they will do enforcement. Now, as we indicated, we are providing the public health department in Adams County, Tri-County Health, with people to help them on a voluntary basis to call businesses, call individuals, call wherever they get to remind people of the public health order and its requirements. We are not, let me repeat, we are not providing anybody from law enforcement to do any kind of enforcement because we are hoping that most people will understand the severity of what's being issued under the public health order. If there's any enforcement action, it will come through the public health department, not from the city at this time. And let me finish that. So the other part of that is that if someone was to ask you, I'm hoping they will be smart enough to say, Brian, where are you going? And if you say, I'm going to pick up dinner, they'd let you go pick up dinner because that's still an allowable piece.
Excellent. Thank you for that, Mayor. This next question again comes to us from Brian. He is asking, how are people from one county that is not under a curfew affected if they are traveling through another county? So obviously we see that there's a curfew that's in Denver that's a little bit more stringent on some things in comparison to Adams. But if you are in Arapahoe or if you're in Weld or any of those and you're coming through into Adams County, et cetera, or vice versa, how is that if you're traveling from one to another that may not have the same reciprocity as far as curfews are concerned, how, if anything, does that affect the person traveling?
From my conversation with the health department officials in several counties, there is no effect. If you're traveling and you're not stopping and doing things that are gathering, just go on about your business. If you're going to work, if you're coming home from work, if you're on the way home and you're stopping to pick up a meal to take home, just do your business, go on about it, and get home as soon as you can.
Excellent. Thank you so much. And I see Brian has given us a quick thank you for answering his question. This other question, I do see Brian Head's comment. Lori, I see that you're in Federal Heights. We'll try and get you connected with some folks over there so you can ask that more specific question. And then I'm going to mute myself, Mayor. I know you had some more information. We have a couple of questions that are on here, but they're not COVID. So we'll wait to ask those as soon as you're done with some of those other information pieces.
The only piece, Juliet, that I was going to bring up is just the couple of items on the council agenda for tonight. One will be tonight is the first vote on the budget for 2021. That takes place tonight. And the second one that I know people have been interested in, and this is the IGA regarding voting on Stanley Lake. That will be on the agenda for voting tonight. From my perspective, we have two major partners in the storage of water at Stanley Lake. Stanley Lake, from the shore level out, is owned by the city. But the area where the water is owned by FRICO. But there are three parties who store water there: Thornton, North Glen, and Westminster. Our storage partners have been very adamant, and we have an IGA that has taken us the last year to negotiate to help reduce the risk to the city. But I will tell you up front, the IGA does not allow, and none of our partners have agreed to allow, boating back on the lake. That will be up for a vote tonight. Nearly 300,000 people rely on Stanley Lake be kept clear of diseases and things like that so that it doesn't get into our water systems. And we've talked about this extensively. The impact right now without this IGA being in place could cost Westminster tens of millions of dollars if something happens today, because we're still under the old IGA. And it has no end date to when that could be impacted. That tens of millions is primarily to our system. But under the old IGA, we would also be responsible for any impact to the water systems for Thornton and North Glen, which could get up into 30s of millions of dollars. This new IGA eliminates the total risk being left to Westminster and is a shared risk if something happens that is not done by us or anybody else on purpose. But it's a sharing risk, which is a big difference than what we've had in the past. And they understand that there are things that outside the control of Westminster that could happen. It could be anything from something gets dumped in the lake, either intentionally or accidentally, that could contaminate the lake. Then we would not be held singularly responsible for this. So that's after a long time of working through this process, and the vote will be taking place on that tonight. This has already been passed by North Glen, I think is the other one. I think Thornton has it scheduled either this week or next week for them to vote on it. And since it's been put together as a product by all three cities, we'll see where everything ends up over the next couple of weeks. But this is all being done to ensure that we have safe, clean drinking water. And yes, I'm sure that some people are going to be upset that the boating is not likely to be back on the lake. But the number of people in Westminster who have had those permits is very small compared to the overall number. But these are the people who are putting the severity of what could happen to that lake and to our water, is putting that very first and foremost on the agenda, that we are first and foremost to protect the water. If you want to go back to the other questions, Miss Juliet, we'll try to cover those.
Absolutely, and thank you, Mayor. I know there's likely going to be a full discussion on the IGA later this evening in council. So if those of you are interested in hearing the discussion and different perspectives, please do hop onto that broadcast whenever they do air it. So City of Westminster is allowing you to view most of City Council on YouTube. So if you have not already connected to their channel, please do so. A lot of what the mayor does share with us that's going to be on the agenda is covered in the evening. And so we just like to give you a heads up on what some of those items are. This is a completely random question, and in fact is stated as a random question by Brian Head. And so his comment is, knowing that we've had a recent economic development director, Mr. John Hall, of course, has gone over to Broomfield, sadly. So he has recently moved on into that new position. Does the mayor have an update on his replacement? So knowing that that has recently transpired over this last month, do we have any new direction on someone that is potentially filling this, or is there a search that's currently going on to fill that position?
Well, to Brian's point, we want to congratulate John. This was a promotion for John. He's now a deputy city manager for the city and county of Broomfield. And that was a big jump for him. And we appreciate all the work John did. If you remember, actually, John has been employed by us twice in the Economic Development Office. And we are very proud of all the work he did. John didn't go very far away. He still lives in Broomfield just like he did before. Currently, that position is being filled by Jody Andrews, who's the deputy city manager, and John worked for Jody. That was within his department. There has been no decision how soon they will open up that. We're still watching anything that has an open position as far as employees as it affects our budget, but no decision on and no timeline of when that may or may not be posted.
Excellent. Thank you so much, Mayor, for that answer. So I do just want to circle back on the ICU beds that you mentioned earlier, and I'm glad that you clarified about here's projected estimates leading up to Christmas, and then here's the expected that it may be doubling. I'm also glad that you went in a little bit detail, because that's always a question that we get from people is how many of those are being used by COVID, but you did go in detail on, it's a combination of things, and obviously the worry is that who do you prioritize when you have all of these medical conditions that need that. So thank you for going in detail on that effort as well. We appreciate that. So what does the landscape look like as far as what we do next, Mayor? I know we've touched on folks to make sure that they're keeping socially distant, that they are, if they're at home, that they're not holding, large gatherings at home, and that they have their masks and everything on. Are we wanting to encourage them with those continual messages, or what can we leave them off with? Something that they can take and do actionably.
Well, what I would ask people to do is be very conscious of the things that are being mandated through public health orders today, and what you, as common sense, know. Every opportunity to prevent a mandated stay-at-home order. Now, out of the governor's office, we have been told that he is not considering a statewide stay-at-home order, but will likely do it on a county-by-county basis. We are probably at the high point of his list right now as Adams County, but we've not heard that that's in the process of happening. The public health orders are there to try to mitigate and to slow the curve down and to reverse it if it's possible. If these actions that are being taken by either Adams or Jefferson County, whichever one you're living in, or any of our surrounding counties, don't work, or we don't get people to facilitate the encouragement of them and their families, then your only option is you're going to move to stay at home. I have repeatedly said for weeks and months now, I don't want us to get to the point of having to go back to stay at home if we can prevent it. And really, it's up to the people to prevent it. It's not that any one segment of the world is doing something wrong that's causing everybody else, but it's a number of them. Again, our small and large gatherings outside of the office areas are the things that are causing us the biggest problems. And getting people to take responsibility for it is part of what we all must be helping with. If you know people that are we just went through the Halloween, and we know that people were having Halloween parties. We know that they were exceeding the number of people. But if we can't get a control of that, then that group, whoever they are, how many of there are going to have an impact that's going to affect all of us, from the cities to our businesses to employment. Look, we have some small businesses that are just barely hanging on. And because the economy is down, they're not seeing their typical levels of business. Many of the council members and staff members have been doing CARES calls all last week, and some carrying over into this week, calling businesses. I myself have called a number of them. They are hanging on where they can. But I did talk to at least two that have said they are down to less than 10% of the employee base that they had, and they don't have any indicators that they're going to get a resurgence of business just because of the type of work they do. So they are facing closing their doors. And many of these companies have been around for 40 and 50 years. This is just not good for our economy to do this. People need to have a job. People need to have a business to operate. People need incomes. They need to pay rent. They need to pay mortgages. But if we have small groups that's causing these big infection numbers like this, and they're not paying attention or they're not working with us to try to get those down, we are all going to suffer from it.
And to that point, Mayor, I would urge anyone, if you have taken part in an activity or a large gathering, go get tested after you've done that so you can make sure that you are well and you're not reintegrating if you are carrying something and you're not just showing the symptoms. So please do your part so that our businesses are doing okay. You've already heard that a number of these orders that are coming out are affecting our businesses, the times that they're able to serve and how often you can stay out there. Honestly, we've done a lot of tracking to see who's causing what, and they are bearing the brunt of a lot of the decisions that we're making. So please be mindful of that. Quickly, there are a couple of things that I wanted to go over. I know Lori just gave a quick thank you to you, Mayor. Thank you for this information that we've shared. The city is conducting those care calls. I know they've come back and been able to circulate if we have businesses that were interested in participating. We are kicking off our Dine Local campaign in partnership with the City of Westminster and the Chamber. It starts on Friday the 13th. It'll go all the way until December the 11th. In place of the taste, it's now the Taste of the Metro. You have over 30 days to go out and taste different restaurants and diners across the city and, of course, the surrounding area. So if you are a business that's interested in that, let us know. And if you are a consumer, please make sure that you put your wallet where your heart is, and you support that cause. And then earlier, before we hopped on the broadcast, obviously my backdrop's a little bit different. There's no one running around in the backdrop as we had earlier, but we are here providing PPE distribution. So if you've not already filled out the form, if you're anywhere in Westminster, whether it's Jefferson County or Adams County, partnering through Jeffco, we're able to provide you with gloves, sanitizers, alcohol wipes, masks, all of that at no cost. I know we have over 15 different businesses that were just approved today for us to go ahead and turn around and do. So make sure that you request that if you need it, but also rewind and rewatch this. There was a lot of important information the mayor went over. We want you to be able to share that out with folks that you know, and also feel free to hit the share button on this video so others in your network can see it and hear what's going on. This video is available to you at any point in time to rewatch. Give us that hashtag replay if we are no longer live. And then if you think of a question or a comment, or you had something that you weren't comfortable asking us on the air, you can always type that into the comment section later. You can DM us or you can email us, and the mayor and I will get back to you with those answers, of course. And I hope you guys stay warm. I hope this conversation, although there were some stark numbers, it motivates you to make sure that you're supporting business, that you are taking things considerately and as seriously as you can. And thank you to you, Mayor, for taking some time out of your morning to be here with us. I appreciate it every week.